Good morning, everyone, and thank you for joining us at QI Power Hour. My name is Tracy Sharon with the Saskatchewan Health Quality Council. For those of you joining us for the first time today, QI Power Hour is a free monthly webinar series hosted by us here at the HQC, and it's for improvers from a variety of sectors with an interest in improving health and healthcare and an interest in learning about quality improvement related topics. I'm really happy to welcome you here today. I want to acknowledge that I am joining you today from HQC's offices in Saskatoon on Treaty 6 territory and the homeland of the Métis. And at HQC, we serve the entire province of Saskatchewan. That also includes traditional lands that are parts of Treaties 2, 4, 5, 8, and 10 as well. And as a descendant of European settlers, I want to acknowledge that I have responsibilities under treaty to support, nurture, and protect the land and the peoples who share it. Also at HQC, we are taking action towards reconciliation and to support cultural responsiveness in our own organization. To keep us accountable to that and to see what we are doing and what we are learning, you can visit our website at saskhealthquality.ca. All of our QI Power Hour sessions are recorded and posted to our website, so please feel free to check it out and take a look at your convenience at today's session or at any other session that we've hosted in the past. While you are on our website, I'd also encourage you to sign up for our QI Power Hour email newsletter, and then you'll get notices about upcoming sessions and details about how to register straight to your inbox. We are very excited to see how QI Power Hour continues to grow in participants that are joining us from across Saskatchewan, across Canada, and around the world. And so we really want to thank you for spending an hour of your time with us today and for your commitment to ongoing learning and improving the systems that you are each a part of. We would really like to see a lot of engagement and participation in our webinar today, and you can do that through the chat function. So we'd encourage you to check that out. If you've never used it before, it's that little speech bubble in the bottom right-hand corner of your screen. You can click on that and enter your comments, your questions, and ideas. I see a few people have started using it already to let us know where you're joining us from today. If you haven't already done that, please do so now. And we'd also encourage you to participate throughout the session as well. We're hoping to have some time for questions and answers at the end. And so I'll be monitoring that and pulling those forward to the end as well. So please enter your questions there as well. So without further ado, I am very pleased today to welcome two speakers from the Métis Nation, Saskatchewan, to tell us about Métis wellness in Saskatchewan. And so I'm pleased to welcome Tanya Pruden, who was born and raised in the northern border communities of Flin Flon, Manitoba and Creighton, Saskatchewan, and has strong roots in both First Nation and Métis culture. She is a member of the Lac La Ronge Indian Band and resides in Saskatoon on Treaty 6 territory and the homeland of the Métis. Tanya currently works at the Métis Nation Saskatchewan as the Director of Health, and before that, she worked as the Health Program and Services Manager. So welcome to Tanya. Also very pleased to welcome Tegan Brock, a fifth-generation Canadian with French, British, and Norwegian ancestry, and who was raised in Toronto. She has a background in community-engaged research with First Nations and Métis peoples in Saskatchewan and Ontario. She has experience in community-engaged qualitative research and building relationships with and between diverse parties, including academic scholars, local Indigenous governments and peoples, provincial agencies, and industry. I'm very pleased to welcome both of you today, and I'll turn it over to you to share your presentation with us.
All right. So Tegan,
I'm just waiting to be able to switch to the next slide. There we go.
Perfect. So Tansei Pitakwe, hello and welcome. Thank you, Tracy, for the introduction, and Marzi to the Health Quality Council for inviting us here to share about how Métis Nation Saskatchewan is responding to Wichihu support, answering the call to Métis wellness in Saskatchewan. We are speaking to you from the homelands of the Métis and Treaty 6 territory in Saskatoon. I am Tanya, and as Tracy mentioned, I'm the Director of Health for the Métis Nation Saskatchewan Ministry of Health. I'm presenting today with my colleague Tegan, who is our Health Research and Data Manager. So we want to start with a background on who the Métis people and nation are. The Métis emerged as a distinct people nation in the historic Northwest during the course of the 18th and 19th centuries, prior to Canada becoming a formal nation state. While the initial offspring of these unions were individuals who possessed mixed ancestry, the gradual establishment of distinct Métis communities outside of First Nations and European cultures and settlements, as well as the subsequent intermarriages between Métis women and Métis men. This resulted in the genesis of new Indigenous people, the Métis. The definition of Métis as adopted by Métis Nation Saskatchewan is a person who self-identifies as Métis, is of historic Métis ancestry, is distinct from other Aboriginal peoples, and is accepted by the Métis Nation. The Métis Nation grounds is assertion of nationhood on well-recognized international principles, including a shared history, common culture, unique language, Michif with various regional dialects, extensive kinship connections from Ontario westward, a distinct way of life, traditional territory, and a collective consciousness. The area known as the historic Métis Nation homeland includes the three Prairie provinces and extends into Ontario, British Columbia, Northwest Territories, and the Northern United States. There are an estimated 80,000 Métis people in Saskatchewan, and currently we have over 27,000 citizens registered with Métis Nation Saskatchewan. So Canada's historic relationships with Indigenous peoples have been steeped in colonialism, and successive governments have failed to acknowledge and respect the inherent rights of Indigenous peoples, including their rights in relation to the land, their distinct governments, their customary laws, traditions, and unique cultures. The Métis Nation emerged in the historic Northwest with its unique multilingualism. I will pronounce that word at some point a little bit more clearly, and its own collective identity, territory laws, legal orders, self-government institutions, national symbols, culture, arts, customs, way of life, and relationships to the land and other Indigenous peoples prior to Canada's westward expansion. The Supreme Court of Canada has recognized the Métis are one of the Indigenous peoples who were living in the Western Territories prior to Canada's westward expansion after Confederation, and that this pre-existence gives rise to the Métis rights, interests, and claims that engage the honor of the Crown and the process of reconciliation mandated by Section 35 of the Constitution Act of 1982. On February 24th, 2023, Métis Nation Saskatchewan Canada signed an updated Métis Nation Saskatchewan Self-Government Recognition and Implementation Agreement. This updated agreement is an important milestone in the ongoing work to promote reconciliation, advance the Métis Nation Saskatchewan's vision for self-determination, and build a stronger nation-to-nation, government-to-government relationship. So the Métis Nation Saskatchewan is the government that represents Métis citizens in Saskatchewan. Métis Nation Saskatchewan is built on a foundation of Métis identity, culture, values, and language. Empowered by the Métis within Saskatchewan, MNS works to advance Métis rights and strengthen capacity. MNS represents the political, socioeconomic, cultural, and educational interests of the Métis in the province through an elected representative system at local, regional, and provincial levels. The fundamental principles which guide the governance of Métis Nation Saskatchewan are based on the MNS Constitution. The governance structure includes the executive roles of President, Vice President, and Provincial Secretary, a cabinet, the Provincial Métis Council, the PMC, which is composed of the executive and elected officials representing all 12 MNS regions, one representative for the La Ville de Madeleines, Women and Gender Equity, and one youth representative. The Métis Nation Legislative Assembly, MNLA, is the governing authority of MNS, made up of the presidents of Métis locals and the provincial Métis Council. The MNLA has the authority to enact legislation, regulations, rules, and resolutions governing the affairs and conduct of the Métis in Saskatchewan. Finally, the MNS Secretariat is the administrative and operational side of the government and employs 270 people. Core government offices are in Saskatoon, and expansions are underway for programs and service delivery, decentralizing services from center of province to rural and remote communities. The MNS Ministry of Health is part of the MNS Secretariat. Right, so I'll pass it off to Tegan.
Yeah, thanks, Tanya, for that overview. So next, we wanted to open with a national definition of Métis health. And this definition has been developed in collaboration with other Métis governing members, including Métis Nation BC, Métis Nation Alberta, Métis Nation of Ontario, and Les Femmes Michif Otipemisiwak, which is the national Métis women's organization. So this definition states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It is a state of balance and interconnected relationships between physical, mental, emotional, social, financial and economic, spiritual, environmental, and cultural well-being. And it is the extent to which Métis people, families, or community can achieve individual or collective well-being now and for future generations. So we open with the Métis definition of health, as this definition provides the foundation that supports all the work we do within MNS Health to achieve our goals and objectives that will improve access to high quality, safe, and culturally responsive care with reduction of Métis health disparities, inequities, and health risks for Métis citizens, improve health and well-being status of Métis citizens and Métis communities, establish, enhance, and maintain Métis health research and data governance policies, procedures, and systems, as well as create the vision to implement our own Métis-specific health authority to best service our Métis peoples. We also have Métis-specific social determinants of health that stem from the unique history and experiences of Métis peoples in Canada. So the Métis social determinants of health are distinct from the determinants of health for the general population. And you'll see that many of these determinants are interrelated. So income and social status, poverty, housing, race and systemic racism, colonialism, employment, education, childhood experiences, including adverse experiences and protective experiences, physical environments, the natural environment and climate change, social supports and coping skills, culture, languages embedded within culture, healthy behaviors, access to health services, biology and genetic endowment, gender diversity, and relationship to animals, lands, and waters. The Métis social determinants of health are also reflected in the vision of health for the Métis Nation Saskatchewan. So our vision of health is that Métis Nation Saskatchewan is a healthy, self-sustaining, sovereign nation that is rooted in Métis culture, language, values, and community. Our government will act in solidarity to protect and advance our traditional homeland and the rights of our citizens under Section 35 of the Constitution. So MNS believes all Métis people deserve access to both good health outcomes, and incorporated into that is access to good quality health care. This is what we believe health equity should be. And as stated in Section 35.1 of the Canadian Constitution and in the recommendations of the United Nations Declaration on the Rights of Indigenous Peoples, our nation believes in providing accessible health programming and supports to all of our citizens. So for MNS, quality improvement in care is really rooted in our nation's ability for self-determination and having the authority to govern and provide input to the programs and the services that support our citizens.
So these are the health and wellness priorities that have been identified through engagement with Métis communities and that guide our work. One of the top priorities is extended health benefits, as Métis are not covered by the non-insured health benefits model that First Nations and Inuit receive. Alongside other governing members, we are leading the development of a distinct Métis-specific extended health benefits model that can suit the needs of Métis in each province. We won't go into each of the priorities today, but we just wanted to highlight the major gap in healthcare support that is accessible to Métis, because currently there's no funding to support extended health benefits. And Tegan, if you want to add a little to the Métis research.
Yeah, so you'll see Métis research needs assessment and evaluation as a priority. And this one's really critical because it is a major gap. So there are currently no identifiers for Métis in the provincial population data sets, health data sets. And so we're therefore unable to carry out Métis specific analyses to generate Métis population health trends in the province. And as we know, we really do rely on that robust and accurate information in order to make good health policy decisions and also to generate effective programs and services or health interventions. So right now we are working to address these gaps, and currently we are partnering with the Health Quality Council, the Saskatchewan Cancer Agency, the Saskatchewan Ministry of Health to identify and access Métis specific health data that already exists in the provincial registries. And we're also working with multiple research groups at the University of Saskatchewan on community-based research projects, as well as leading our own research and data gathering initiatives among Métis communities in the province.
So it is extremely important for MNS to lead the work of developing health and wellness programs that are accessible across the province, and to improve the financial hardships, emotional stress, and anxiety that many citizens experience. At MNS, health equity is more than just being equal and having equal opportunity. And health equity to our nation is about sovereignty and leading through effective partnerships. It is about defining who we are and leading by who we are as the Métis people. It is about creating safe and ethical space with feasible access to care that is based on distinct Métis health experiences and needs. Through a Métis-specific health equity, we have control of the funds used to manage our own programs effectively based on the needs of our people, rather than having to compete with others for the same funding and initiatives. We can embed cultural values and languages in all the program we offer that is specific to the Métis ways of life. And we can apply our own data and research that is owned by us, for us, and allows for us to evaluate and understand the true impact of programs within our communities. This is what we see when we think of health equity. Perfect. So on this slide here, we're just going to go into some of the programs and services that we do have. Our approach to program development and health promotion always starts with our citizens, listening to their experiences, their successes, and their needs. Through our engagements with citizens in 2019 and 2020, we heard loud and clear the requirement of support with medical travel. In response, we implemented 3 travel programs that started out as pilots in 2020. As seen here, we currently have the dialysis, cancer, and medical travel programs, which all work to support citizens with fuel, meals, and accommodations to attend their health appointments. Since 2020, we have supported more than 4,500 appointments and over 170 citizens through the cancer travel program, 23 citizens through the dialysis program, and over 1,400 citizens through the general medical travel program. Next slide. So another example of Métis distinct programming we have available is the Métis Patient Support Worker Program and Patient Advocate, which helps with patient navigation in the healthcare system and provides advocacy for Métis patients experiencing concerns with the healthcare system. The patient support workers are located in Saskatoon, Regina, and Prince Albert, and directly support Métis patients who require assistance with cultural support, travel, communication with their care team as examples. Since implementing these programs, the Saskatchewan Health Authority is asking for more patient support workers in other locations. Tegan, if you want to take this next slide.
Yeah. So another project that we recently completed is the Métis Patient Cancer Guidebook and Journal. This was also in direct response to what we heard from citizens, and that there weren't Métis specific cancer resources that were things that they could identify with and relate to. So this document shares patient diagnosis stories and Métis cancer journeys, as well as practical information to support patients and their families through cancer diagnoses and treatment. The journal also has space for citizens to write down information during appointments, to track their treatment schedule, any medications, side effects, those sorts of things. And this is a really effective model in terms of connecting with citizens and working with practitioners and our partners. And so we're using that process to develop other guidebooks, including one for cardiovascular diseases, kidney disease, diabetes, supportive and palliative care, as well as tobacco reduction and disability services. We also have our M&S nicotine replacement therapy program that's aimed to support citizens in quitting smoking and improve the health span of our nation. And this program essentially provides reimbursements for the costs to purchase nicotine replacement therapy drugs. So we do plan on expanding this program to include peer support groups, as well as an 8-week facilitated program in a group setting with both individual and group activities tied to reducing the use of commercial tobacco. Oops, sorry, I'm zooming in instead of going to the next slide. So we also have heard that mental health, I think we all know this, especially after the pandemic, that mental health is a huge focus area. And we do have a separate ministry that's very closely tied to the work that we do, but we have a Ministry of Mental Health and Addictions. And we also operate the Mental Health and Addictions phone line program that secures a broad range of mental health professionals available to Métis across the lifespan. So our colleagues also in the M&S Ministry of Mental Health and Addictions are starting a mobile outreach program in Saskatchewan, Regina, and PA to provide support to our most vulnerable population and to continue to promote and support Métis health and wellness using harm reduction tools, access to culture, referrals for outpatient virtual day programming, detox and stabilization, and inpatient treatment, along with referrals to M&S support system navigators, as well as the patient support workers and the patient advocates that Tanya talked about earlier. So looking forward, we have a number of upcoming projects. We are continuing to grow and build our research and data capacity and partnerships, and the HQC is a big part of that. We're adding medical vans to our medical travel assistance program. So this will make the program more accessible to citizens without vehicles, as well as cut down on program costs. So currently the program is a reimbursement style model, and with the medical vans, we'll actually be able to provide more travel service assistance. We are also launching a Wellness Through Our Lands program that will provide grants to Métis communities to host land-based activities. And the aim of this program is to provide trauma-informed and culturally grounded activities to support positive mental health for citizens of all ages, from our young ones all the way to our elders, and especially having activities that can bring them all together. And then, as mentioned earlier, we will be expanding our commercial tobacco reduction programming and services. Our team is also working to develop a model for an Indigenous birthing center that offers midwifery services both in-house, and also the goal is to provide those services in community. And then again, as mentioned earlier, we're working on more Métis-specific, developing more Métis-specific resource guidebooks that share Métis voices and stories, as well as important and accessible information.
So these are just a few quotes from the citizens to share how the programs are meeting citizens' needs and what these programs mean to them and their families. So just as a couple quotes that you can see there, your help is very much appreciated. Your gift of the smudge kit was very nice surprise and very thoughtful. Mental health help is so expensive and many can't afford it. This program has saved my and my family's life. And I want to say thank you from the bottom of my heart for the support and assistance M&S has provided my family. It is truly a life changer. I will also add a lot of our citizens do say a lot of good things about our programs and how it's helping to service their needs.
Yeah, Tanya, I might jump in here because I skipped over it a little bit when I mentioned the mental health phone line. So this program I think is quite unique because it It provides case management as well as linking citizens up with the counseling supports that they require. And so not only do they have access to paid services, they also have follow-ups from our staff to check in and to kind of identify and do an ongoing assessment of what their needs might be and ensure that we can do our best to accommodate them. And so I think we've seen a lot of successes with that program, and I think it's a model that we would certainly like to expand going forward.
Absolutely. And thank you for sharing that. Okay. So despite the hard work of our government, we still face significant barriers and challenges. We are doing a lot with little resources as all of our funding is short-term and proposal-based. Much of our success is grounded in strong relationships with our partners, including the Saskatchewan Health Quality Council, Saskatchewan Health Authority, Saskatchewan Cancer Agency, University of Saskatchewan, Canadian Partnership Against Cancer, federal agencies, and many others to name. However, persisting challenges remain, including service gaps, jurisdictional gaps, healthcare staff shortages, especially in rural places, funding gaps, lack of extended health benefits, demand for our M&S services outweighs our capacity, and these barriers extend to all services, not just those tied to health. Again, partnerships are extremely important to address all of these barriers and challenges. So we continue our strengths-based work grounded in equity. The Métis Nation Saskatchewan Health Equity Model contains 4 main pillars: community wellness programs, including M&S-led programs and services, and extended health benefits; health data and research, including access to and control over Métis-specific population health data, and gathering community and citizen experiences; elder care. This includes extended health benefits, long-term, palliative, and continuing care services, and social programming; and mental health and addictions, including mobile outreach, land-based healing center, and M&S transitional housing, in addition to connecting citizens to mental health services through our phone line. This model and the use of the affinity symbol shows the continuum of care that is needed and that we need to service all Métis, regardless of age, income, location, etc. The model also represents the weaving of Western and Indigenous ways, including Métis distinct concepts of health. Through listening to citizens and establishing strong partnerships with federal, provincial, and local partners, we are demonstrating how to effectively address the gaps in health outcomes between Métis and non-Métis peoples in the province, and doing so through strength-based, culturally grounded, and harm reduction approaches. We look forward to continuing this work and improving the health status and health outcomes of Métis peoples for generations to come. So that is the end of our presentation, and we thank you for being here with us today and hearing what we have to share.
Excellent. Thank you so much, Tanya and Tegan. Really enjoyed hearing all about the Métis Nation and the work that you're doing to help improve health and wellness for Métis citizens. We've got a bit of time for questions, and I've noticed a few come in. So if you're okay doing a few questions, we might go with those now. So one person has asked about, and I think maybe a few of us have noticed, the beautiful artwork on the slides and also on some of the materials that you shared for the programs. And just wondering, who designed those, and just want to recognize they're lovely. So any info on that?
Absolutely. So the artwork and all the beautiful things that you have seen on our programs is all created through our storytelling and creative department at M&S. We have Craig, hopefully I said his last name right, Craig Meduick. Is that correct, Tegan?
I'm not sure.
I can't.
I'm not sure
Yeah,
either. Sorry.
he's probably gonna say my name properly next time. But we do have Craig and his team at M&S who do all the designs for our artwork. So.
And the art that's on the Cancer Guide and Journal is by Victoria Beam. And I think she's also an intern. She's a young Métis student, and she was interning with M&S last summer, and that's when she created those visuals. So she's very talented.
Excellent. Thank you. Yes, they're beautiful. We've had a couple of questions. Folks are interested in the Indigenous Birthing Center initiative, just wanting to learn more about the program, who the partners are. So if you want to say a little bit about that, I think that would be appreciated.
So yeah, I can speak to a little bit of that. So right now we're currently in our first year of the project, so we're just exploring it right now. We're doing a little bit of research to see what midwifery looks like to the province of Saskatchewan and for the Métis. So as we research that and we, engage with communities, we start engaging with other midwifery or doula professionals, also to our health authority here in Saskatchewan. We can kind of identify what the needs are for Métis women and birthing peoples in Saskatchewan, and see what we can do to kind of implement our own Indigenous birthing center to them. In year 2 of the project, that's what we'll be exploring next, is what does that look like and which communities do we have to reach out to establish these. So yeah, right now it's just exploring it to see what it looks like and to identify that need.
Excellent, thank you. Another question here that was sparked when you were talking about collecting and using data. And this a person is curious about if the Métis Nation has recommendations about how we gather, access, store, and assure privacy of that type of data in the context of, I believe the Métis principles are OCAS. When there's a multitude of involved stakeholders and when people may not feel safe sharing and participating in such data collection initiatives. Do you have any recommendations for folks on, if they are collecting their own data in their own settings, for example, how they might do that well?
Yes, I can touch base on that one. So that is a big question. I'll just start with that. I think so there are the OCAS principles, and MNS we've developed and we're kind of just working on the finalization of a data health research and data governance framework that is slightly different than OCAS. I believe OCAS was developed in Manitoba by the Métis in Manitoba. But very similar concepts in terms of stewardship. So, I think the most important thing is to have Métis Nation Saskatchewan, if it's in Saskatchewan, involved in any of those data gathering initiatives, because we're really trying to establish that capacity and even that role of kind of safekeeping and really ensuring that Métis data is being treated carefully and is being treated in a way that it is owned by the citizens who are offering up that information. That is the key piece. And that the reason for that is because, it still happens today, but also historically, research was for the sake of academics gathering information and using it as they wanted. And so it's really shifting that concept of, researchers owning data to the folks that actually provide it or the ones that own it. In terms of, and I agree that there needs to be a lot of care taken when asking for identification, given that a lot of folks don't trust that that information is going to keep them safe. There's a lot of reasons that they might mistrust that if they divulge their identity, that they might be treated poorly because of it. In terms of the work that we are doing to identify Métis in the larger data sets, the process that we're using going forward, and this is still a very ongoing process of making it happen, but we do have our citizenship registry. And there are ways to essentially link data sets through identifiers, personal identifiers like first name, last name, and date of birth, and linking that information so that we can pull from the provincial registries and keeping all of that information anonymous, essentially, so we can gather those larger data sets and aggregate them so that we can still carry out those analyses. So that's one of the ways that we can do this safely, essentially. And in that case, MNS is the one that is safeguarding and controlling use of those data sets. So it wouldn't be possible for example, SHA or MOH to use those data sets without the consent of MNS. So I hope that answers the question.
Thanks so much. Just really hearing the importance of, really understanding your purpose for wanting to collect those data, what you will do with it, how that will benefit the people that you're collecting that data from. And of course, I did hear an ask to connect with the MNS to get some advice and guidance prior to initiating any of that. So yes, I hope that answers the question. Feel free to ask again if there's anything we missed there. Okay, I'm just going to check the chat again because I've noticed a few comments come up here. One was, a comment related to happy to see the responsiveness and initiatives being brought forward to meet the needs accurately. I know that's something that stood out to me as I was listening to your presentation is it looks as though, the Métis Nation has put a really high priority and a lot of effort into understanding the needs of citizens and responding to those needs. So just curious, I guess, if you want to say a little bit about how you collect that information about what people need, what people want to see, and then what you're learning about, you've initiated so many programs, what you're learning about what's working well with that, that maybe others could learn from as well.
Absolutely. I think when it comes to like the programs that we're offering, and it mainly comes from our citizens just sharing exactly what it is that they require and hearing about those needs at the community level, right? And it's always brought forward to us each and every day. Some of our citizens, when they call in for the medical travel program, they'll call in about like, is there support for any of the other medical equipment or supplies that they're needing as well, right? We have a citizen who's going to the dentist. Is there support to cover, their dental services as well too? So we think of that, what those citizens are bringing forward to us, and then we try to like take in what we can and apply something to help meet that need, to help meet that gap of what they're experiencing. We also heard from our citizens before too, when they do travel from, especially our northern communities and they're in the urban centers here for like hospital appointments or in hospital, they don't really have somebody there to support them, either with it be language or maybe it's just, access to other services or information to other services. And so we were told that from our citizens, and we responded with that patient support worker program. So that way the patient support workers were there in hospital to help service them while they're here attending a hospital visit. Um, we've also heard from like our citizens before too, when they have like escorts coming with them to hospital, that escorts also need to be supported. So how can we help service that need? So we've kind of like worked together with our patient support workers and our medical travel program to see how we can implement, some getting access to food vouchers while in hospital. So again, a lot of these things that we are developing is all in response to what our citizens are asking of us and how we can help service that. And yeah, Tegan, if you want to add in here for.
Yeah, I can just add just that I think we developed a really good foundation of understanding during our community engagements in 2019 and 2020. I believe we did 7 in person, and those kind of led into the lockdown of the pandemic, and so we had to complete them virtually, but our goal was to complete 12, so 1 in each region in person, and that's something that we're hoping to get back to soon. But even having those conversations in person and raising questions that were related to experiences with the healthcare system. We also focused those engagements on the cancer care system, asking about what the key challenges and barriers have been, and then also asking about what their vision for solutions are. I think that elicited so much information that really has provided a foundation for all of these programs that we've been developing. So just going and having those conversations, and then like Tanya said, since we've been implementing them, we're hearing from citizens regularly, and I think we also hear often from our regional directors because they tend to be the main contact point for citizens in each region. So they hear a lot and they bring that forward in those PMC meetings and the MNLA meetings. So those are kind of the main ways. And then we are working on this is more on the research side, but just to kind of continue that momentum and get input on more specific things, we are working on using surveys. So that isn't something that we've quite rolled out yet, but the health department has plans for that.
I just wanted to add to that as well too. Yeah, like you mentioned surveys. So surveys, we want to implement those so we can evaluate the programs effectively to see how they're actually meeting those needs. But from what I can gather right now, from what I'm hearing, just from that community level, it's beneficial to the citizens that are able to access it, and we're just happy that we can provide something right now. So, yeah.
Excellent. Thanks for that. So I've seen a few more questions pop up, which is great. And feel free, folks, to add some more as well. We still have a little bit of time left. So this next one is about, I think I'm going to interpret this a little bit. So whoever asked, you can let me know if I've not interpreted it correctly, but I think it's asking about access to patient support workers, particularly within mental health. And do people have to access that directly through MNS, or are they able to request access to that, within an inpatient care setting? Or I think it's just a question of how people might go about doing that if they're in inpatient care or another mental health and addiction space.
Well, I know what they're. Oh, go ahead, Tegan.
Well, this is, I don't think you would have picked up on this, Tracy, just because we have different terminology for the programs. I think this one is specifically the patient advocate, which is a separate program from, in terms of, I would say, how folks connect with them. So the patient support workers are located in hospitals, so they're kind of in the acute care. But I think in this case, the question specifies patient advocate, which is available across the board in terms of service provision. Tanya, I think I can look to get the contact info for them and I can add it in the chat because we are right now, it's still quite a new program. So we actually haven't put the kind of the posters and the promotional info out on social media and on our website yet. So it would be hard to try to direct you to it. Add anything else there, Tanya, but I'll look for the contact info right now.
Yeah, that sounds good. I'm also kind of curious to know if that question is relating to our mental health programs as well. So we do have mental health case workers through our mental health program through that telephone line that we had mentioned. So Tegan, if you can also share that phone line as well. That phone line can be shared with all Métis citizens or those who are in progress, or even those who just want to inquire more to the program services available. They can call in that number. We do have caseworkers who are able to provide case management and then kind of link them up to different counseling services available or psychiatry services available as well too. As for the mobile outreach, I think that's also mental health focused as well too. It's kind of like a navigation system as well. That will be implemented sometime, I believe, in September or October. And plans are to have the mobile outreach workers in the urban centers. So the mobile outreach workers will kind of work one-on-one with citizens who are needing it, and then help link them up to the right services available.
Excellent.
Yeah.
Thank you so much for the information and for the
You're
clarification
welcome.
as well. Tegan, sorry, I might have cut you off there. Was there something else you're going to say?
Just one more thought, seeing that question, just to clarify that the advocate can be accessed directly. They don't need to be accessed through the mental health program.
Yes.
I think that's what the question was.
Excellent. Thank you so much. So there's another somewhat related question here, I think. Curious about how programs and services from MNS are connected to those within the SHA. So, to what extent are the two organizations, co-designing programs or co-locating, and to what extent are they separate? So this person's curious about that.
So I think, yeah, with our patient support workers, I think that one was more co-designed. So we were wanting to, link our citizens up with, a support worker that's specific to Métis. That were one of the things that are one of the priorities that we heard from our citizens during our community engagements. And so we had reached out to SHA because they had the First Nation Métis Health Services. and the health educators who are already kind of like doing the floors over at the hospital, helping to service those citizens, First Nation and Métis. And so we reached out to them on how we can collaborate and how we can kind of work together to define this position. So that way our patient support workers can have that access to the hospitals, access to the patients, and be supported in that work. So it's still in kind of development right now because it's so new and we're still kind of like identifying how this program is is going to work. Again, it's with a pilot, it's always new. Um, but yeah, so we're kind of like working on towards that. And right now it's based as like a referral program. So like if there is a patient who is in hospital, the health educator works with them or works with the patient to identify what kind of services or needs that they have and then links them up to our patient support worker, to which our patient support worker will call the patient or receive a call from the patient and then work with them directly one-on-one. Our patient support workers have been helping to assist in like setting up accommodations for their escorts or helping to assist getting transportation back home after being discharged. So we have our services through our M&S capacity, and then SHA has their services within their capacity. And we're trying to like work that together to make this program for the patient support workers a success. As for the advocacy work, we're still kind of working on that as well too. Again, that's going to be a collaborative initiative there because we would like to advocate for our citizens who are experiencing any type of health concern or issue within the healthcare system. So yeah, there's a lot of work that needs to be involved in that as well. And again, these programs, they're a little bit new, but with anything new, it's going to take a little bit of work and ability to get there. So.
Excellent. Thank you. Yeah, it's always really nice to see. And I know you mentioned, in other initiatives as well, the partnerships you have with other organizations, people coming together to see, what can we do to work together to offer this service to people, and seeing lots of examples of that, that in your work with your partners.
Mm.
I think the other comment I'd make, just from the comments that are appearing in the chat, just a lot of gratitude in the chat for the work that you're doing to serve people. A lot of excitement about seeing the responsiveness to people's needs and the variety of programs that you offer. So a lot of people seeing so much value in the work that you're doing. So I might just offer, we have just a few minutes left, if there are any other questions or comments that people have. And maybe I'll offer, while folks are thinking about that, Tegan or Tanya, if you have any further comments you'd like to add.
I did just see one comment about NIHB mental health providers.
Yes, I must have missed that one.
And I'm not so maybe one clarification that we can make is that when we talk about Métis extended health benefits, that is, fundamentally in terms of the benefits that are being provided, there will be similar, but we are developing a completely different model than NIHB. There's a lot of challenges with NIHB. It's quite a bureaucratic system, can be really hard to get paperwork in. And so our goal with the extended health benefits program is to create a completely different model that would be provincial based. So each governing member will kind of have its own distinct model. There's certainly going to be similarities, but we would like to be working directly with the insurance organizations, essentially. And so that's why we're using slightly different terminology. It's not going to be NIHB, but fundamentally the provision of services will be similar. And then when it refers to mental health providers, I just want to clarify that the caseworkers that connect citizens to mental health supports are employed by M&S, and so that is a M&S housed program. It's not associated with the NIHB system.
Mm-hmm.
Excellent. Thank you so much for noticing that and for the answer to that question. And we've gotten one more, which is great. So what would be the best way for a non-Métis healthcare provider to learn about programs that are offered and to help patients access them? So this is someone working in a community healthcare setting. how could that person find out what's available and be able to refer people?
Well, we do have all of our information posted on our website. They can go to métisnationsk.com/health, and we have most of our information to the programs and services available through that website. I do believe that there is plans to convert all of our programs and services information for citizens to access through our MAFA-Me web portal. So MAFA-Me is a little bit new for us, and it will be implemented here in the fall of 2023. I can't share too much information on it because it's not mine to share just yet, but just to kind of throw it out there, as it will be available to the public again, like I said, in fall 2023. But there is plans to have our programs and services, like I said, for citizens through that web portal. But all information right now can be seen at the métisnationsk.com website.
Excellent, thank you. So I'd encourage folks to check that out to see what's available. I also noticed someone is asking whether people will receive a copy of the presentation. So a recording of the presentation and the materials will be posted to HQC's website following the presentation shortly after. So you can look for it there. Okay. Oh, one final question. I think we've got time for this last one. So what types of staff do you employ at Métis Nation?
Oh, goodness. We employ a wide variety.
Yeah, I would say, I mean, we have, M&S has many departments from social infrastructure to education to policy to environment. Like there's so many departments. And so I think that in itself, it's a wide variety of skill sets that are needed. I think often the folks that we are hiring for the services that we provide have some kind of background in health. We have a few nurses, we have folks that have social support worker backgrounds. I'm just trying to think, Tanya, anything to add?
Yeah, backgrounds in social work, backgrounds in Indigenous studies, working within Indigenous organizations is another one. Those who have understanding of Métis culture, identity, knowledge, and values is what we employ. We employ those who we feel like would be best suited for the position that's available. I know within our department, like I said, we have a wide variety of staff who have, their skills and abilities. And I do have to say that I'm very proud of the staff that I work with, proud of the staff that I do have here, because each and every one of them show their commitment and their dedication to wanting to service the Métis Nation, the Métis Nations of Saskatchewan. So yeah, I'm truly proud of that, and a lot of them too. They have that focus, that dedication, and the desire to try to create something new, right? Because the one thing I see here too is a lot of the things that we are implementing are new, and it does take a lot of thought work behind it to get it out there. But the thought work comes from what we are hearing from the citizens, and yeah, I find that all of our staff, that's what they listen to first in order to make their work successful here in the department and for the nation.
Excellent. And I just encourage folks again, I know the Métis Nation Saskatchewan has a comprehensive website with lots of information about how it serves Métis citizens in Saskatchewan. So please, I'd encourage folks to check it out. Lots of good information there about the work being done. So with that, we've reached the end of our time. I, again, just really want to give our thanks to Tanya and to Tegan for spending some time with us today, for sharing your presentation about all the great work being done to respond to citizens' needs, for answering all the questions that folks had. Thank you to all of you listening for joining us today, for asking lots of questions, for engaging in the discussion. I think a lot of people learned a lot today about what's being done and some really exciting work happening as well, and lots of new ideas being tried, which I think is always very, very exciting and challenging work at the same time. So I just want to thank Tanya and Tegan for joining us today. I just have a couple of slides left to wrap up, and then we'll be done our session today. So I just wanted to share that as a show of our gratitude for speaking at QI Power Hour, you will both receive this lovely pair of I Love QI socks. So you can look for those in your mailbox. And if any of you out there listening want to be the proud new owner of a pair of socks, we'd love to hear from you about your QI Power Hour topic idea. So we'd love to hear from listeners as well about topics you might like to talk about on this session as well. Please feel free to check out our website and get in touch if you have some ideas. You will, when you leave the webinar, be taken to a post-webinar survey. You'll get a screen that looks something like this. Please don't be alarmed. It is a legit survey, and we'd really love it if you filled it out. We do look at the responses and use those to continuously improve QI Power Hour. So please do take a few minutes and let us know what we're doing well and what we could be doing better. And finally, looking forward to joining all of you again next week on Friday at the same time with Dr. Ginger Ruddy, who will be telling us about the patient's medical home. So I'd encourage you to sign up for that if you haven't already, and join us next week at the same time to learn about that. So thanks again, everyone, for joining us. Thanks again to Tegan and Tanya for sharing all of this information. And we hope to see you next time. Take care, everyone.